everyone, welcome again to my YouTube channel. I'm Dr. Ivy. And if this is your first time visiting this channel, please kindly click the subscribe button below. And today I'll be discussing on a very interesting topic. It's actually an eye condition, more of a eyelid condition, and it's called a stye. In other words, it's also called a hordeolum. Now I'm going to give you all the information you need to know about a stye. So just relax and enjoy. So I'm going to actually give us explain what a stye is, or a hordeolum. Now it is an inflammation of the eyelid which is associated with accumulation or collection of pus. It's usually painful, and it looks like a boil on the eyelid. So that's basically what a stye or hordeolum is. Now we've actually classified them under two types. We have the external and the internal hordeolum. Now for the external, is actually located on the outer part of the eyelid. Then for the internal one, it's actually just like the name implies, it's actually located in the inner parts of the eyelid. It's usually more painful anyway than the external hordeolum. Now there are some symptoms that are actually associated with this lid condition. One of it is pain. Pain is one of the symptom. Patient comes in and says, I have pain there and it's swollen, or rather it looks like you boil, there's a boil on my lid. Then the patient also says it's itchy, there's tearing, there's discomfort on blinking, there's also discharge of mucus around the area. Then you also notice that they're like crustings or on the eyelid margin. They look more like flakes around the eyelid margin. Then sometimes there's also difficulty seeing or blurry vision as a result of the drooping lids. So another symptom is drooping lids. So these are like a few symptoms the patients actually present with, or they say this is what they're doing, and you too can actually observe see some of the symptoms. Now, there are people who are at risk of having this. One of them are people who go to bed with their makeups on. For the ladies, please ensure you try to take off your makeup before you go to bed. That way you avoid getting a stye. Another set of people are people who also use expired cosmetic products. So ladies, try to check your products before use, and try to also keep checking to be sure of when it gets expired, so you don't use an expired product and in turn predisposing yourself to having a stye or hordeolum. Then another set of people are our contact lens users. So if you don't wash your hands properly before using your contact lenses, you can also introduce germs and bacteria into the eye, and in turn you're also predisposed to having a hordeolum. Then I'll also advise my contact lens wearers to also try as much as possible to disinfect their contact lenses before and after use. That way too, they can also limit or reduce the amount of germs that gets into the eye, and in that way also limit or avoid having hordeolum. Then another set of people are people who tend to rub their eyes all the time with unclean hands. So that way you introduce germs and bacteria into your lids and your eyes, and you're also predisposed to having that. So that's that. Then another set of people are the people who actually don't eat balanced diet, who just throw in anything in. So poor nutrition too can also be like a predisposing factor for you having it. So because when you don't eat well, you don't have if you don't eat well, your immune system tends to be low, and you tend to get all manner of infections into the system, be it the eye or the body. So try to make sure you eat well. And for the children, our parents, so I'll try to encourage the parents to try to encourage a hand washing culture for the kids whenever they are doing, whenever they are playing, because this eyelid condition is not just peculiar to the adults. Children too have them. So as parents, please try to monitor and introduce a hand washing culture for your kids. That way, you try to avoid or limit their exposure to germs and bacteria that can in turn cause stye. Now for the part which I love, and this is where I come in as an optometrist, that's the treatment regimen. So for the treatment regimen, I actually prescribe an eye ointment, which is more of an antibiotic, anti-inflammatory combination to the affected eyelid. I ensure that the patient lowers the lid and press the content inside the eye. That way, it tends to reduce the inflammation and in turn also help the pus, the collection of pus around that area to drain out easily. Then I also advise my patients to do what I call a warm compress. You get a clean towel, put it in warm water, and massage that area for about 3 to 5 minutes for 3 to 4 times daily. That way too, it reduces the inflammation, reduces the pain, and also helps in the proper drainage of the pores. Then another thing I also advise my patients to do, especially for those that have the external hordeolum, I try to advise them to pluck out the lashes around that area. That way too, they can also drain the pores easily. And finally, I also advise my patients to try as much as possible not to wear their contacts or any form of eye makeup during the process of treatment so that they don't reinfect the eyes. So these are like the few tips or few things that you need to know about hordeolum. Now, there's one thing I want to leave you with, which is the eyes are like the window to the soul, so they are indeed very priceless to us. So I will encourage everyone out there to try to introduce or probably try to ensure that they get their eyes checked every 6 months. Your optometrist should always be your go-to person because the eyes are indeed priceless. They should be your best friend. So I'll encourage everybody, everyone listening, please try to do your routine eye checks once every 6 months. That way you can get all the information you need and also be abreast with whatever condition or issues are with your eyes. So with that said, please, once again, I'll urge you all to please subscribe again to my YouTube channel for more eye care tips. And it's me, your lovely Dr. Ivy, your favorite Abuja eye plug, signing out. Peace. Bye.